Question 1. Which item is required PPE for caring for a patient in contact precautions for MRSA? A. Surgical mask. B. Gown and gloves. C. N95 respirator. D. Face shield only. Answer: B. Gown and gloves. Question 2. The nurse is caring for a patient with chickenpox. What type of precautions are appropriate? A. Standard and contact. B. Droplet and contact. C. Airborne and contact. D. Airborne only. Answer: C. Airborne and contact. Question 3. Which action by the nurse helps prevent a urinary tract infection in a catheterized patient? A. Irrigating the catheter every 12 hours. B. Keeping the collection bag above the bladder level. C. Securing the catheter to the thigh. D. Disconnecting the system to obtain urine samples. Answer: C. Securing the catheter to the thigh. Question 4. A patient with a draining wound has a known MDRO. What is the most appropriate room assignment? A. Room with another surgical patient. B. Room with a patient receiving chemotherapy. C. Private room. D. Room with a patient with similar infection. Answer: C. Private room. Question 5. What is the most appropriate response when a visitor refuses to wear PPE in an isolation room? A. Allow the visitor to enter if symptoms are absent. B. Document the refusal and proceed. C. Inform the visitor that PPE is mandatory. D. Report the visitor to hospital security. Answer: C. Inform the visitor that PPE is mandatory. Question 6. Which task can be safely delegated to a UAP when caring for a patient with C. difficile? A. Administering oral antibiotics. B. Assessing skin breakdown. C. Assisting with perineal care. D. Teaching hand hygiene technique. Answer: C. Assisting with perineal care. Question 7. The nurse prepares to administer an injection. What must be verified first to maintain a septic technique? A. Syringe brand. B. Needle length. C. Expiration date and packaging integrity. D. Patient preference. Answer: C. Expiration date and packaging integrity. Question 8. When opening a sterile package, what is the proper distance to maintain between the sterile field and unsterile objects? A. 1 inch. B. 2 inches. C. 6 inches. D. No specific distance required. Answer: A. 1 inch. Question 9. The nurse observes a student nurse blowing on a sterile field to reposition a sterile drape. What is the correct action? A. Allow it since gloves are sterile. B. Reinforce sterile field etiquette. C. Have the student proceed quickly. D. Discard and start a new sterile setup. Answer: D. Discard and start a new sterile setup. Question 10. A nurse receives a used isolation gown from laundry for reuse. What is the appropriate response? A. Accept and use it if it looks clean. B. Disinfect it with alcohol. C. Report the violation to Infection Control. D. Store it for emergency use. Answer: C. Report the violation to Infection Control. Question 11. A patient with HIV is hospitalized. Which isolation precautions are necessary? A. Airborne precautions. B. Droplet precautions. C. Contact precautions. D. Standard precautions. Answer: D. Standard precautions. Question 12. What is the nurse's priority action after noticing that the central line dressing is loose and soiled? A. Reinforce the dressing. B. Call the provider immediately. C. Replace the dressing using sterile technique. D. Document and monitor for signs of infection. Answer: C. Replace the dressing using sterile technique. Question 13. Which situation requires the use of transmission-based precautions in addition to standard precautions? A. Urinary tract infection. B. Pressure ulcer. C. Norovirus infection. D. Hypertension. Answer: C. Norovirus infection. Question 14. What is the correct way to handle soiled linens from an isolation room? A. Shake them out before placing in hamper. B. Roll them inward and place in isolation linen bag. C. Carry them unbagged to the laundry chute. D. Discard them in regular trash. Answer: B. Roll them inward and place in isolation linen bag. Question 15. A nurse teaching a class on standard precautions should include which example? A. Wearing gloves when emptying a catheter bag. B. Gowning before entering any patient room. C. Mask use for every encounter. D. Hand hygiene only if gloves are not used. Answer: A. Wearing gloves when emptying a catheter bag. Question 16. A nurse is evaluating cleaning staff. What practice would require correction? A. Using EPA-registered disinfectants. B. Cleaning least soiled areas before heavily soiled ones. C. Disinfecting from top to bottom. D. Reusing cloths without disinfecting between rooms. Answer: D. Reusing cloths without disinfecting between rooms. Question 17. What is the appropriate cleaning method for a blood spill on a tile floor? A. Use a mop and water only. B. Absorb with a towel and discard in trash. C. Clean with a bleach solution 110. D. Cover with a sheet and report later. Answer: C. Clean with a bleach solution 110. Question 18. Which of the following would most likely lead to a healthcare-associated infection, HAI? A. Early ambulation post-surgery. B. Hand hygiene before catheter insertion. C. Intermittent catheterization using sterile supplies. D. Infrequent change of 4 tubing beyond 96 hours. Answer: D. Infrequent change of 4 tubing beyond 96 hours. Question 19. Which measure should the nurse take before entering a patient's room on airborne precautions? A. Don a surgical mask. B. Perform hand hygiene and wear gloves only. C. Wear an N95 respirator mask. D. Open the windows for ventilation. Answer: C. Wear an N95 respirator mask. Question 20. The nurse is teaching home care for a patient with a draining wound. Which statement indicates a need for further instruction? A. I will wash my hands before and after dressing changes. B. I can throw used dressings in the kitchen trash. C. I will use gloves during wound care. D. I will avoid touching the drainage directly. Answer: B. I can throw used dressings in the kitchen trash. Question 21. A nurse is caring for a patient with a known airborne infection. Which room assignment is most appropriate? A. Shared room with same-gender patient. B. Negative pressure room. C. Room closest to nurse's station. D. Standard private room. Answer: B. Negative pressure room. Question 22. When removing PPE after providing care to a patient in isolation, which item should be removed first? A. Gown. B. Gloves. C. Mask. D. Goggles. Answer: B. Gloves. Question 23. A nurse accidentally sticks themselves with a used needle. What is the immediate action? A. Wash the site with soap and water. B. Apply antiseptic and continue care. C. Notify the unit manager immediately. D. Begin antibiotics. Answer: A. Wash the site with soap and water. Question 24. A UAP is assisting a patient in protective isolation. What action requires intervention? A. Wearing gloves before entering the room. B. Bringing fresh flowers into the room. C. Using dedicated equipment. D. Wearing a mask during care. Answer: B. Bringing fresh flowers into the room. Question 25. Which task is appropriate to delegate to a UAP in a patient on droplet precautions? A. Assessing lung sounds. B. Teaching about infection control. C. Feeding the patient lunch. D. Administering oral medication. Answer: C. Feeding the patient lunch. Question 26. What is the best way to dispose of a used surgical mask after caring for a patient in isolation? A. Place in the laundry bin. B. Discard in a regular trash can. C. Place in a designated biohazard bin. D. Store in a sealed container for reuse. Answer: C. Place in a designated biohazard bin. Question 27. A patient diagnosed with measles requires which of the following precautions? A. Contact only. B. Droplet only. C. Airborne and contact. D. Airborne only. Answer: C. Airborne and contact. Question 28. Which scenario demonstrates correct sterile technique? A. Reaching over a sterile field. B. Turning your back to the sterile field. C. Keeping sterile items 1 inch inside border. D. Holding sterile objects below waist level. Answer: C. Keeping sterile items 1 inch inside border. Question 29. A nurse is teaching a group of nursing students about HAIs. Which example represents an HAI? A. Cellulitis present on admission. B. UTI after catheter insertion during hospitalization. C. Community-acquired pneumonia. D. Surgical site infection from a procedure done at home. Answer: B. UTI after catheter insertion during hospitalization. Question 30. A patient with a central line shows signs of infection. What is the nurse's priority action? A. Administer prescribed antibiotics. B. Notify the provider and obtain cultures. C. Flush the catheter with saline. D. Change the dressing and continue monitoring. Answer: B. Notify the provider and obtain cultures. Question 31. Which type of hand hygiene is appropriate after caring for a patient with C. difficile? A. Alcohol-based hand rub. B. Soap and water. C. Antimicrobial wipes. D. No hand hygiene is needed if gloves were worn. Answer: B. Soap and water. Question 32. The nurse is changing linens on a bed with visible blood. What is the appropriate PPE? A. Gloves and gown. B. Gloves only. C. Mask and gown. D. Mask only. Answer: A. Gloves and gown. Question 33. Which action best reduces the risk of surgical site infection? A. Using non-sterile gloves during dressing change. B. Removing dressing with clean technique. C. Performing hand hygiene before wound care. D. Using warm water to irrigate wounds. Answer: C. Performing hand hygiene before wound care. Question 34. The nurse is teaching about proper cough etiquette. Which statement by the patient shows understanding? A. I will cover my mouth with my hand. B. I should wear a mask if coughing. C. I will wipe my nose with my sleeve. D. Coughing in any direction is acceptable if I turn away. Answer: B. I should wear a mask if coughing. Question 35. A nurse is preparing to insert an indwelling urinary catheter. What is the most critical first step? A. Draping the patient. B. Lubricating the catheter. C. Opening the catheter kit using sterile technique. D. Telling the patient to relax. Answer: C. Opening the catheter kit using sterile technique. Question 36. Which action during medication preparation poses the greatest infection risk? A. Wearing gloves while handling pills. B. Using a syringe from a sterile package. C. Touching the tip of a syringe. D. Scanning the medication label. Answer: C. Touching the tip of a syringe. Question 37. A patient with tuberculosis is discharged home. Which instruction is essential? A. Stop all medication if you feel better. B. You no longer need to wear a mask at home. C. Cover your mouth and nose when coughing. D. You can return to work immediately. Answer: C. Cover your mouth and nose when coughing. Question 38. What is the purpose of transmission-based precautions? A. To eliminate pathogens completely. B. To reduce transmission of known infections. C. To avoid using PPE. D. To provide psychological comfort. Answer: B. To reduce transmission of known infections. Question 39. A nurse receives a patient from the ER with suspected meningococcal meningitis. What action is needed first? A. Obtain consent for lumbar puncture. B. Notify the family. C. Place the patient on droplet precautions. D. Start 4 fluids. Answer: C. Place the patient on droplet precautions. Question 40. What is the correct procedure after removing gloves contaminated with body fluids? A. Discard gloves and exit the room. B. Wash hands with soap and water. C. Apply hand sanitizer over gloves. D. Put on a new pair of gloves immediately. Answer: B. Wash hands with soap and water. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!